how important healthy gums are compared to the beautiful teeth. Do you offer the choice to your patients?
Honestly, no, because I'm convinced that there is no patient on this planet who would want an invasive option.
What separates a good dentist from an extraordinary or exceptional dentist?
You cannot be an exceptional dentist without
Technology or experience?
experience.
Reputation or revenue?
100% reputation. We don't compromise on sterilizations at any cost. So the fact they are women, that's an advantage. I used to visit clinics, both medical and
Right.
dental, where there were 100 people sitting in the waiting area and the doctor would arrive 1 hour late.
Most of the people invest with the growth curve, but you did all the investment together. From where do you get this courage, since many of the dentists don't have this courage?
You don't have to dance in an Instagram reel to attract patients because
You had to be a dentist.
I would not be comfortable going to a doctor who's rolling on the floor for some likes and some followers. There is a line where you should not forget that you're doctors. Your journey is yours and nobody can take it from you what is destined to be yours.
Hello everyone, very special thanks to all of you for following us and watching our all episodes. Our today's guest is not just one of the India's most respected periodontists, she has built something very few dentists dare to build. While most practices try to be everything for everyone, she chose the difficult path of becoming known for one thing and becoming exceptional at it. Recognized as the best clinic in India at the Femdent Excellence in Dentistry Award 2026, an international educator, global speaker, faculty at international universities, and one of the pioneers of laser and perioplastic dentistry in India. She has dedicated her career to the saving teeth that many would consider unsalvageable. Please welcome the one and only Dr. Apoorva Gupta. Thanks, Dr. Apoorva, for taking out time and joining us today.
So thank you, Dinesh, for having me. It's a pleasure. And I really like to congratulate you on the 3 successful episodes. I think this is the 4th one.
Yes.
And this is so great of you to have an initiative to celebrate excellence. And I have been following up on the podcast. It is great to know what my colleagues are doing and what their thought processes is. So congratulations.
Pleasure is ours. Dr. Apoorva, did you choose dentistry or dentistry has chosen you?
I think I'm saying it for the first time, but definitely dentistry chose me, and specifically perio and lasers chose me. That was never the plan.
Is it?
Yes, because I wanted to be a scientist
Okay.
or somebody in theater,
Hmm.
and this was exactly opposite. But you know, you have these cues from the universe, and you just get into that. And because the journey was so rewarding, I started saying that I chose perio and lasers, but that was not the truth. Definitely, dentistry chose me.
Perfectly. Then they have found the right actor in the area of dentistry. You are
Maybe.
playing your role very well.
Maybe.
Now, coming to the next question here. Most dentists build a practice around doing everything, right? Which is the easiest thing to do. You choose the toughest path. You build a practice around doing fewer things but doing them exceptionally well. Was that your confidence or it was a madness?
I think that was madness because confidence comes when you're doing the same thing again and again for so many years. But this decision of opening a referral practice where we decided not to do bread and butter in dentistry, which is root canals and bridges, and doing pure perio was just being mad. I just had a dream of having India's first referral clinic and doing what I'm good at. And there was no end point or the result of that. I just wanted to do it and be the first one. So it was pure madness.
Yeah, it looks like pure madness. But with this madness, there are many challenges and many rewards when you do the single specialty practice, particularly into the dental specialty. How do you put this around the challenges and around the rewards?
Yes, it was a very, very, very demanding journey, more than I imagined. I was prepared it's going to be very challenging. But I think the toughest part of doing a specialty practice or referral practice is you're dependent on other colleagues and dentists to refer you patients. You don't have a template, you don't have a blueprint. and it's about making one mistake less. Especially in periodontics, I did not have a studio or a clinic in India to envision and have a role model, or some looking up to something that I want to be like this, and this is a path of success. I was trying something, so everything was at risk. So making one mistake less every day was the plan, but it was a very challenging thing. And the best part of having a specialist practice or the referral clinic is you are doing what you're good at, and you're responsible for your actions, and you're accountable for something what you are good at. So you are doing what you know, your team is doing that one same procedure, so everybody's in sync. So that way it is very easy. So I think the procedural part is easy because you are replicating the same thing again and again, back and forth, pre-post. But the journey is challenging. So I think once you get there, then it's going to be fine.
Are you a perfectionist?
I'm not a perfectionist, and I don't believe in perfection. I feel everything should be done with a lot of conviction and sincerity. And if that means perfection, then I don't know. But I don't know what perfection is. I just want to be real and very genuine when I'm doing something.
But you have become role model to many aspiring dentists, and particularly in the area of perio, which is, I believe, one of the toughest path. But you have created a space for yourself, which many people aspire to achieve. Many people still think a periodontist only treats gums. What do you actually do every day, and how important healthy gums are compared to the beautiful teeth?
Frankly speaking, your gums are 50% of your smile, right? And we are not just treating gums, at least I don't say that. We are into regeneration.
Okay.
So we are growing the tissues, which includes both soft and hard tissues, to hold on to your natural tooth or to hold on to your infected implants. That's what our specialization is. And then we are also bringing down inflammation because our perio center is becoming more holistic. That patients who are coming with medically compromised situations, or they're diabetic and they have uncontrolled sugar. So we want to at least clean their mouth and bring down the inflammation, and that reduces the body's inflammation. So it's definitely beyond just treating gums.
What the one dental problem which you want the patient should address earlier?
I think the most important thing that I would want all my patients to address earlier is bleeding gums. If your gums bleed for a microsecond, you need to be alert, and it would be nice if you see your dentist and get an x-ray done, because most of your gum problems or the perio problems are seen in the x-rays and not seen in the mouth. And by the time patients are mostly referred to us, or when they land up in our clinics, they are always on stage 4 or stage 3, and we are struggling to fix it. So I think if they just address this one small problem of brushing and flossing every day, we are going to be sorted.
Yeah. You mentioned in your earlier response that you treat the inflammation of gum and simultaneously the inflammation of the body. It is a big statement. What do you mean by this?
So I'm not sure how many of us realize that we are all like a body full of inflammation, and I hope there are some people who are without inflammation. And post-pandemic and post-COVID, we see that you had, the high CRP levels and the high interleukin-6. So COVID was not an infection, it was an inflammatory problem. So we have these situations like obesity, metabolic syndrome, diabetes, pregnancy, smoking, and arthritis or cardiovascular problems or lung diseases. So when you have these systemic problems, the body's inflammation go up, and so your oral health also go very bad.
Okay.
So, and then if we are treating the oral health and reducing the inflammation, because everything is connected with the vascular supply, then the body inflammation also goes down. So we have started seeing patients as a holistic approach, but it's a very subtle information which is so important to the patients. So yeah.
But this is a knowledge for the audiences. Many patients who are watching this show, they will get benefited out of it, since inflammation of body is the really concern, and I didn't know that it is related to the gums also. But now I understand and getting educated that this is for the entire body, not only to gums only. Many of our colleagues and the patient know you as a laser queen, right? How has the laser technology shaped your journey as a dentist, and what difference has it made in the lives of your patients?
So I think the patients and the colleagues are too sweet. They have come up with this word. I have no clue where it is coming from. It's affectionately, they call me like that. And as a dentist, it has made a huge difference. I was a surgeon. I was trained as a periodontist, and scalpel flaps stitches was my life. But suddenly, when I was in clinical practice, I realized it is not about what you are good at and what you are trained at and what your heart wants to do. It is about what the patient wants. And patients never want surgical procedures, that you would not want a surgical procedure in your mouth. You would look for a procedure which is minimal invasive, no downtime, and it's not difficult. So, as a dentist, I started changing my treatment planning and making it so minimal invasive that most of the times patients were choosing lasers over scalpels. So that was a very big chunk in my professional career. I was able to do perio because I was not giving them conventional offer like a blade, but I was asking them to use some technology which was very minimal invasive and safe. Yes.
Do you offer the choice to your patients?
Honestly, no. Because I'm convinced that there is no patient on this planet who would want an invasive option or who would be dying to please give me blades, please, I want some stitches. So I choose the best. And I tell the patients that if you go out of the office, you would be given a choice of flap surgeries or sutures. Of course, there are some cases where you need that. But if you can avoid it, why not? And trust me, there are no patients who ever choose surgeries over not having pain.
I will never choose.
Yes.
I will never choose, and I believe nobody will choose. You had a successful career as a consultant for over a decade before starting your own clinic. What was the hardest part of transitioning from being an independent clinician to building and leading your own practice, and what has been the most fulfilling part of this journey?
I would say as a consultant, yes, I was very successful because mostly it's not routine to call consultants as successful because you don't have identity or recognition, and financially it's not very rewarding. But thankfully, I was working with the top clinics in Delhi and NCR and also outside Delhi, and very well paid, good procedures. I was doing what I wanted to do, but I was getting tired because it's not easy to move around in Delhi with the traffic from one office to another. I was working with 47 clinics as a consultant for 13 years.
That was a big number.
Yes. And I was exhausted. Plus, I was lecturing all around the world. So I thought physically it was so demanding that I started thinking that I can't be doing this for the rest of my life. And I'm aging now. So yeah, so that was I thought.
I believe nobody will believe it. You are not aging. That was not the right statement. You are growing, and you are growing very fast.
Thank you. You're too kind. Yeah. I wanted to have my own thing. And the difficult part was the accountability and the responsibility. When you're working for somebody else, you just go and finish the patients, but you are not responsible and accountable for other people in the team. But the fact that now some sort of independence is lost, and then you are accountable for your actions, and you're responsible for the entire team because you're representing not your just self, but everybody under that one roof, is the most difficult part of that transition. And I think the most rewarding is the fact that you are able to make a brand and there's a personal connect with the patient. And that's why I think we are all in a medical circle and we are about human emotions. So that is a very rewarding part.
I was just thinking, behind the scene and making the scene.
Yes.
Visiting consultant and owning the clinic. So was that a motivation too? And you are the dentist who is at the forefront of the scene, or the superstar of the scene.
It's not easy, okay? Because sometimes you don't want to be seen and you want to be at the back and, pull out the guns on somebody else's shoulder.
Yeah.
But I would choose the other option. That was not the plan, because in the hindsight, when I started, I wanted to be the star. But now I feel somebody else should come and take the bullet because I don't want to be.
So you're making multiple stars in your clinic. I can see it. Whenever I speak to you, Dr. Apoorva, you speak about excellence in every walk of life, whether it is the practice, it is the patient outcome, and even the kind of the gentry you are treating in your clinic, right? I never see the crowd in your clinic, but you treat the top of the cream people who live in the South Delhi and across the country who visit your clinic. So we will speak something about the excellence versus averages, right? What separates a good dentist from a extraordinary or exceptional dentist?
So I think I was very fortunate to meet so many nice, exceptional dentists in my journey as mentors, as colleagues. And one or two traits that are common in all of them were they were deeply invested in the procedures. And I'll tell you something that I observed. You cannot be an exceptional dentist without being an exceptional human. So all of them were exceptional human first, discipline, focus, hard work, value system. And then they were good dentists. You can't be an average human and be exceptional in your work. It's what your upbringing is and exactly what you do in your professional life.
Discipline is one word which we speak a lot, but which is rare to adopt and follow. So how you are so disciplined in your personal and professional life both?
Discipline is, like you said, very, very, very tough. But if you get used to it and adapt it when you're young, then it becomes easy and then everything else becomes easy. And the most important thing about discipline is you have to be disciplined when nobody's watching you. You can't be just disciplined in work when everybody's around you. So that is one thing. If everybody learns, then your professional and personal career, the rest is very rewarding because you fix the most difficult part of your journey, which is being disciplined.
Do you believe that this is one of the most important virtue of yours, which has taken you from where you have reached?
I think yes.
Great. So this is a message to the fraternity. Any young dentist who are watching Dr. Apoorva is speaking this. Discipline will certainly add a lot of value to your skill, your commitment to the profession, and your qualification. And it will make the journey stronger and more rewarding. Do you think that talent is overrated comparison to obsession, which you have?
Yeah, that's why I'm smiling. Yes, I think so. I think talent is, it's important.
Right.
But when you're curious, that leads to passion, and passion leads to obsession. And I presume that we are all talking about healthy obsession.
Yes.
And you need to have that crazy obsession. For example, unapologetically obsessed with my work. I thrive to be on a workaholic, and I enjoy that. It's about meditation. So I think when you are towards that, it's a blessing, and you shouldn't be embarrassed of being obsessed. So that is a path of excellence, I think.
Have you become a profession that celebrates busyness more than mastery?
Yes. Because when I was growing up, I used to visit clinics, both medical and dental, where there were 100 people sitting in the waiting area and the doctor would arrive 1 hour late so that even more people are sitting. And that was considered being successful. But if I see my practice or the practices of my mentors or the people who I look up to or the Westerners, my professors, they're all seeing just 5-6 patients in a day. And each patient is given a lot of time and understanding, and their human bodies. You can't rush into the procedures. So they are more empathetic. So 100%. Being busy doesn't mean you are successful. You need to do something with a lot of faith and with a lot of good intentions, and that needs time.
I have been to your clinic. Every time I had to come, I had to take a time slot. And when I am in your clinic, I don't see the patients in the waiting area. And Dr. Apoorva's clinic is one of the largest clinic in the area she is operating. But I have never seen a patient waiting there. Either they are in the operatory or they are with the consultants, and there is no queue. And even for us, if we had to meet you, then we should have a time slot before and after, then we had to wait. Right.
Yes, I think we need to value time.
Yes.
That is like so important.
What is one thing average dentists do that exceptional dentists never do?
I think exceptional dentist is never complacent, and they don't take the recognition and the fame for granted.
Okay.
And they want to be very consistent and stay relevant.
Is it a very stressful situation to be?
In the beginning, yes, because it requires discipline. But once you are disciplined, then this is not stressful.
Great. We are moving to the other section of the discussion. So you had to give one answer first and then you had to elaborate. Right. Clinical excellence or business excellence? What is important for dentists?
Clinical excellence. And business excellence is a byproduct of clinical excellence.
Beautiful. Talent or discipline? We are asking again discipline.
The topic of this podcast should be discipline. That's a shortcut to success.
Yes. Technology or experience?
Experience.
Reputation or revenue?
100% reputation.
Very important point here. Saving a natural tooth or placing an implant? Very clinical.
What would you want if it's you on the chair?
I want to keep everything which God has given to me.
That is the answer. Saving natural
Cool.
tooth.
Learning from mentors or learning from mistakes?
That is a tough one. You need both. But on a gunpoint, if I have to choose one, I'll pick up mentors, because I was very lucky to have such good mentors in my life. And when you have extraordinary mentors, they make sure that you don't make the mistakes they made.
International exposure or local experience? You travel a lot.
You need to be working in local community eventually, and those small experiences, especially in India, make you very hands-on person and you come up with all the solutions. But I would still choose international exposure, because that confidence that I had to work and traveling around the world and being all by myself. I've been lecturing for almost 12 years internationally, being at airports, flights being cancelled, your Airbnbs not able to find out on those, empty roads in some different country or city, and then sitting between Westerners, young girl, wanting to learn. When you go through that, there's a crazy confidence your body has. So I think international exposure really gives you a lot of clarity and conviction in your own self that I got because of mine.
Do you mean that putting yourself repeatedly in the uncomfortable
Yes.
situation has made you more stronger?
1000%.
Yeah. Cool. Perfection or consistency?
Consistency. Because you can be perfect, but if you are not consistent and there's no perseverance, you can't take it to the next level.
And with consistency, perfection comes out.
Comes out. Yes, that's
Yes.
a byproduct.
We have spoken about it. Laser or scalpel?
My clinic's name is Perioplastic and Laser Dentistry, which is scalpel and laser. You need both, because there are some part where you need the finesse of the blade and some, but I have to choose one. Laser, because laser more or less can do everything, more or less, that a blade can do, but not the vice versa. So I'll choose a laser.
Perfect. One skill every young dentist must master.
Soft skills. Very important, because we are all focusing on clinical skill, making cavities, filling the composites and polishing and everything. But I see not even just young, so many people lacking soft skill and bedside manners.
Very beautiful point. Now coming to a very behavioral aspect. Are you a risk taker?
Yes. I would purposely pick up the most difficult task and assignment in the room. Yes.
And how do you get the audacity?
It's about your upbringing also, because, a lot comes your household system. And I've seen my parents doing that. And like what is role of my father in my journey. And he's been that, that voice in your ear. And he said nothing is easy. Anyways, everything is difficult. So you do the most difficult task first, and the rest becomes easy. So that has become just my nature and my habit, that I would never take it easy, and I would never pick up an easy opportunity. I will see everything, and the most tedious, most tricky, and most difficult to approach, I'll pick up that option. It's just in my system now.
Yeah. I asked this question deliberately. When I went to your clinic or come to your clinic, it is one of the most beautiful clinic, first thing. It is most technologically advanced clinic, and it is technologically advanced from day one.
Yeah.
Most of the people invest with the growth curve. Like one machine today, once they earn or grow older in the practice, they get audacity to invest again. And there is a cycle of the investment. But you did all the investment together. From where do you get this courage, since many of the dentists don't have this courage?
One is madness. We spoke about my madness. And I'll tell you something, when I started collecting the stuff, shopping for my clinic, I'm so obsessed with buying expensive things, because that is for the betterment of my patient. I like pampering my patients with good stuff, good technology, good doctors, everything, because my loyalty is toward my patient. That is the mindset behind doing all this. And I was told by a lot of my colleagues and my friends and my seniors that exactly what you said. First year is going to be tough. You will be giving from your pocket. Next year is going to be break even. You know this.
Yeah, that is a
Third
cycle.
year is going to be profit.
Yeah.
So you can't be taking CBCT scan on
Yes.
day one. You can't be taking microscope. What would you do with a scope? And why do you want the best autoclaves or the suctions? And I listened to them, but my heart had an answer because I was opening a referral center. That means the patients are coming to us when everybody has tried the procedure and now they're all tired and they have referred a patient. That means everything is dependent on my diagnosis and the planning, because somebody's already made a lot of mistakes now and the patient is exhausted financially and emotionally and physically. So I can't do the same thing. That means I need CBCT first thing to diagnose a problem. Then if it's a case, mostly our cases are debridements, because perion implants is debridements. Regeneration requires that. I need a microscope to see what is happening. Then, you are doing some graftings, you have stitches. Then I can't make an alginate impression. So I need a scanner to pick up the impressions. And then I need a laser for medically compromised patients, because that is what our office is famous for, autistic children and medically compromised patients. So I didn't buy technology thinking it is technology and I'm building a high-tech clinic. My intention was to deliver what I am supposed to deliver. And in that process, I ended up buying, because this was so important and integral. I cannot imagine treating you as a patient without having the best scalers or the guided biofilm therapy or the autoclaves. I cannot do it. It's essential tools. So that was the mindset.
Your high level of the conviction to deliver the best of the patient outcome.
Yes.
Now, coming to the patient, since you have picked up the patient and everything you do is patient-centric, and you have taken a lot of punt on this, right? Financially and you can say psychologically too. When patients walk into the clinic, what are the invisible signs that tell you whether a practice is future ready or not?
I think it is the smooth operation from the time. First of all, patients have sixth sense. They know everything. You can try to show them that you are future ready, but they somehow know it. When you become a patient, you have this gut who tells you everything. So from the time of booking appointments, somebody, replying them very nicely and addressing their problem, to somebody receiving them at the parking, and then the infection control, and then the reception knows your name. Then when you meet the associate doctor, she or he has the scans and they know the case and the blood reports, everything is there on the table. Then you come to the main office and the doctor knows your name and your case, and there is a plan, everything is digitalized. Everybody is on the same page, there is no chaos. That smooth operation of in and out. And the patient walks out smiling that there was no hassle. I think that is what the patient knows, that they know it all and this is future ready office.
What should every modern suction and compressed air system deliver to a clinic beyond just functionality?
You should be answering that.
No, I'm not. I'm not speaking on behalf of some organization. This is an independent channel and you should speak about it.
I have a question.
Yes.
Is it der or is it doer? First of all.
Doer.
Thank you. Because I see some people saying it der, so I wanted to know, let it come from the horse's mouth, that what is the pronunciation. Thank you.
So Ulm, which is there only in German.
Okay, good to know. It's not about functionality. I can talk for myself. It is about optimum functionality.
Okay.
I want my patients to be very comfortable. I don't want my suctions to stop last moment, especially when we have a referral center where there's non-stop bleeding. And I don't want my chairs to give me some issues in the middle of the procedure. Because the last thing that we just discussed, the seamless operations, this is very much part of it. And the best part about having the great suctions and compressor, first of all, it's like how you have the heart is to the body, the main things. The patient comes to the chair, that is the last part, but the chair has to be operational first. And you don't want to be embarrassed in front of patient. But that reliability and long-term reliability and the ability to take services hassle-free, one call and it's fixed. That smoothness is so important. And I can say it as a customer, because I remember when we were making clinic, I called your team and I asked which is the most expensive suction
Yes.
and compressor. It was not the mindset of saying that expensive means better, but I didn't want to compromise on suctions and compressor. And I had colleagues telling me, oh, you can take this suction, why you're spending, this kind of money. But that was not even a question. And congratulations to you guys that you are here in India and taking care of all of us and just one call away. You have always addressed my issues. So I'm personally indebted and thank you. Thank you so much.
You give us a lot of strength to us. Customers like you enable us and motivate us to deliver best of the services. Coming to the next segment here, you invest heavily on the cleanliness and the infection control, right? Wherein this is not a practice at many places, not only in India, globally, right? I'll not put India on the pedestal here. Why this piece is missing? Expensive equipment, best of the class patients, but still the hygiene, which is inside and outside. Sometimes outside it is managed, inside it is compromised.
I thought about it, and honestly, I don't have an answer to it because the people that I am working with, my circle, everybody is so conscious about infection control. So I don't relate to the people who are not taking care of these things. Or maybe I just chose my circle like that everybody's at the top of the game in terms of sterilization, infection controls. And if there are some people who are not taking care, it's a very wrong mindset. You should always imagine that your father or your mother or your daughter is on the chair. So would you compromise in infection control and would you use the same mouth mirror in their mouth? No. So why would you do it on the patients? So I'm against this. And for me, sterilization and infection control is very important. Like my office has audio video cameras maximum in my sterilization room because I want to keep a check on my staff.
I've seen that.
Yes, because my staff is not easy. I want them to know that if they miss that 6-step protocol, they're out of the office. We don't compromise on sterilizations at any cost.
This is perfection in this area, and this is very much pertinent. AMR is a problem in the entire healthcare ecosystem, and dentistry cannot be untouched out of it. We had to prevent the infection at every walk of our practice, every step of our practice, and there are multiple options available. I believe awareness and education is one thing which is required to increase attention towards this area. Very special thing now coming for you, right? You are first generation dentist, rather of generation clinician, right? You come from a business background. I know a little about you. Now, second generation dentist versus first generation dentist, how much of the advantage is it really?
So like you said, I am a first generation dentist and I have grown up with second generation dentists. Ironically, most of my friends were second generation dentists. So I've seen their lives very closely. And I don't know if it's a controversial thing to say, but for the second generation, the first part may be easy, but the second is difficult because they have to still survive through and prove themselves. For the first generation, first part is difficult because they are clueless, but then it's become easy because you have done the worst part in the beginning. But if you are looking for excellence and success, both require dedication, hard work, sincerity. So there is no one has a benefit over other. I personally really don't think so. In fact, I feel being a second generation is very stressful. If I have to take a rebirth, I never want to be a second generation, especially when your parents are iconic because you have such big shoes to fill in. There's so much of pressure. And since you are so young, everybody is watching you. And there's so much of expectation and you may not want to be doing that thing or want to do it at your own pace. But somewhere you may be just lost because of that pressure. So I think being a first generation has a crazy advantage that you can make all the mistakes because nobody's watching you and you can decide when you want to be visible when you're ready.
Makes sense. Now coming male dentist and female dentist, are there any challenges while building your practice?
I think while building practice, there are not too many challenges because I always have believed that excellence is gender neutral. But the journey is challenging. I wouldn't say that it's easier for men. Like I said, excellence is and hard work and success, it's equal for everyone. It's not that one person is at advantage and the other person is not. But I think for the women, that journey and the decision making is so difficult. It's like you can be going out, but you can't be outgoing.
Hmm.
You know what I'm talking?
Yes.
You can be approachable,
Hmm.
but you can't be available.
Hmm.
So, those kind of things, which is a very thin line. So I think walking with grace
Hmm.
is so important and so difficult. And it's not forgiving journey for women. It's like a double-edged sword for the women. I don't know. I mean, that's what
You
I
have
feel.
spoken a lot. Means it has never been a gender neutral thing, and it has been a journey itself.
Yes.
Where there were ups and downs, there were challenges,
Yes.
right? But I'm happy what you have achieved in spite of not having the neutrality.
Thank
Right.
you.
You're often referred to as a celebrity dentist and have treated diplomats, public figures, right, and high profile individuals, which is very prominently visible in the community. What are some interesting lessons you have learned from treating people who operate at the highest level?
So I was very fortunate that I started seeing celebrated people or the diplomats very early in my career. So I was in the learning system. Everything was new. And I'm so again grateful to the people who let me work in their offices. The one thing that I realized was they're very particular about infection control,
Mhm.
timings,
Mhm.
predictability of the procedure. There are no sorries. They don't care about the money,
Mhm.
but they care about the results.
Mhm.
You need to give and deliver what you have promised to them.
Mhm.
And there is a lot of clear communication,
Mhm.
and everything is written on the papers.
Mhm.
Because when we are seeing the diplomats, we have these treatment plans going to the embassy signed off with the attaches. So those kind of things. But the advantage is that when you do it early in your career,
Mhm.
that becomes your second nature. So for me now, you don't have to tell me who's who, because my plan is going to be same, and my body language and my team's body language is going to be same. So that's how now we operate.
Exuding confidence and just giving it in black and white
Yes.
makes
Yes.
a big difference.
Yes. Yes.
With a lot of discipline and
Yes.
consistency. What advice would you give to the ambitious young woman, particularly women dentist or any healthcare professional entering today, who wants to build not just a successful career but an extraordinary one like yours?
I am a young,
Yeah,
ambitious woman. I'm nobody to give an
just
advice.
kids.
I'm a
Just
kid.
kids who have just come out of the colleges.
That's me.
People know you. You cannot hide the things.
So the fact they are women,
Hmm.
that's an advantage,
Hmm.
okay? Because women have this sixth sense.
Hmm.
They're committed.
Hmm.
They're sensitive to what things. They're empathetic.
Yeah,
They can
right.
do multitasking. So what it takes to be at the top, they're born with it.
Hmm.
Okay. What I see missing is not people pulling them down. Yes, that is there, but not majority. But they themselves decide to stop.
Hmm.
So I would want young women to pursue their dreams and not let their fears and their inhibitions stop those dreams. And they have to walk with grace, which is very important.
Now coming to the other piece, which is one of the prominent piece in your journey. You travel across the globe.
Yes.
You speak in the different communities on the different platform, which is the topmost the platform across the globe. What is one thing which Indian dentistry is doing the best, and what is one thing where we had to just need to introspect to do better?
I think Indian nation is producing outstanding dentists as clinicians,
Hmm.
because I have been training different nationalities
Hmm.
during hands-on. So
Hmm.
I can actually tell you that which country handwork is better than. I think Indians have a advantage. They are resilient.
Hmm.
They can adapt to any situation, and we perform best under pressure. So we are born like that. Like somebody who's average in India is going to be a topper outside.
Mhm.
So that is a very big advantage, that there's a lot of hard work and sincerity. If you're an Indian,
Hmm.
doesn't matter if you're a dentist or not, but we are just born in a nation. This comes, as
Yeah,
as
even
a whole.
moving from one place to
Yes.
another place is a work in India.
Yes, yes. So, and we are used to the pressure. When there's no
Right.
pressure, then like, that is it.
It is easy.
Yes, yes, correct. I think I would divide it into different strata in terms of patients.
Mhm.
Patient needs to be more aware about preventive care, because we have this habit of flying into the office when you're in pain and something's gone bad, and not showing up on follow-ups in preventive care. So I would want patients to learn there's something called preventive care, and you would not end up having any gum disease or caries or implants if you just be careful, number one. In terms of dentists and offices, I would want them to learn that there has to be a clear communication and everything has to be on paper and not on mobile phones and WhatsApp messages. It has to be emails and great documentation and everything. And at level of companies, I want them to have good services
Yes, of
to
course.
the customers.
Yeah, of course.
Because we can have the best equipment which we have, but I think the services has to be better, so we are not scared to invest in expensive technology.
Make a sense. You have given a perspective to the entire ecosystem of the dental industry of India. The patients need to be more aware about their dental hygiene and the dental care. At the same time, the doctor should be more audacious and confident, giving everything in writing,
Yes.
black and white,
Yes.
to their patient, not on what's a social media platform, but on the pure on paper or via email, which is more authentic source to give. And the companies which sell the product, they should service the product, make the preventive maintenance, so the doctors can deliver the best of the patient outcomes while treating their patient. So we are entering to the other segment. Here again, the myths or truth. You had to give one word answer first and then a short explanation. Patient care, more about price than quality.
That is true, but not, I have not never experienced it, not even as a consultant and not even in our offices, because I firmly believe when you're good at what you are doing and you can deliver what you just said and not break your promise and there is predictability, then patients don't care about the price. We have patients coming from small villages because somebody there in their town said, just go to her, she can save the tooth, and they don't talk about discounts. I was shocked that I was ready to do a pro bono case, but they didn't ask for a discount. So I think, yes, I understand where you're coming from, but I also believe that you need to be more predictable and confident that you deserve what you're asking, and then the patients don't talk about money.
Fair. Another piece, a lot of social media around. But does social media creates the name of a dentist, or it is an enabler to take the good work of the dentist to the masses?
I think it is a enabler to take the good work to the masses. Yes, it's a platform where you can expand and you don't have to pay a lot to the marketing companies because you can do it yourself and just be authentic. But I just wouldn't say that you don't have to dance in an Instagram reel to attract patients, because
You had to be a dentist.
yes, because I'm sorry if I feel this way, I may be an alien, but I would not be comfortable going to a doctor who's rolling on the floor for some likes and some followers. Instagram reels or videos, which make sense and is educative either with the target audience of dentists or patients, makes sense. But there is a line where you should not forget that you're doctors, and that dignity line nobody should be crossing. That's I feel.
Yeah, I also believe this is an enabler to take your good work to the masses. Then your patient become your ambassador, and their word of
They
mouth
talk about you.
is more important than any other thing. Saving teeth is becoming a lost art.
Yes, in this part of the world, not outside.
Not outside.
Because when I'm attending my conferences in Europe and America, all the conferences is going back to saving the natural tooth, because periimplantitis does not have a treatment. And all my professors are going back and teaching how do you save natural tooth. So I think India still needs to catch up, because here we still feel that everybody is into implants. Yes, it is a lost art, but it is so important to save what, like you said, God has given us.
Dentistry is becoming a luxury service.
I have to say yes or no.
You have to say
It's an essential service, but the way it is delivered is becoming a little bit luxurious. But the idea is not to make it luxurious. The idea is to pamper patients. But if that means being luxurious, then yes, it is becoming luxurious.
You have put it in a very good perspective. Everybody loves to be pampered, and hospitals where we go with a lot of sorrow, a lot of grief, and a lot of we go with pain, then these little things matter a lot to calm us down and get the hearing from the clinician. success become easier after your first big achievement?
Success is never easy,
Mhm.
no matter what. In fact, after your big first achievement, everything becomes only tough and tougher.
Mhm.
You know, I watch these tennis legends a lot. I don't play tennis, but I like to see
Mhm.
people's journey. I see Roger Federer and Rafa Nadal, and they always said when they played their first match and won their first Grand Slam or something, it was tough.
Mhm.
But what was tougher was to stay at the peak, because now you're visible and everybody is watching you. So you cannot make one mistake.
What does success mean to you today compared to when you graduated? And if you could go back and speak to your younger self, what would you tell her?
When I was younger and I was graduating, success meant being rank one. Like I said, that I was telling you while having coffee, that I have been always like a topper, graduation, post graduation, MSCs. So just that gratification was success.
Mhm.
But now I think being able to help the patient and have a good sleep, peaceful sleep, is all what I want. That is success for me. And if I have to talk to my younger Apoorva, who
Mhm.
is 10-year-old or 15-year-old, I would say what my dad used to tell me when I was young, and I never understood that. And now, just recently, I understood.
Mhm.
He always said, including my mom, they were great mentors, and you always need that. When you have self doubts, you need this voice at the back of your ear. It could be your parents, your teachers, your good friends, or mentors. And they said they can take
Mhm.
what they didn't deserve,
Mhm.
but they cannot take what you deserved. So you need to focus on your journey and not what their journey, because your journey is yours and nobody can take it from you what is destined to be yours.
It is a big statement, and I believe a great learning to you and to everyone here who are watching out to you. After all the awards and recognition, international lectures, and achievements, what is still excites Dr. Apoorva Gupta enough to wake up every morning and go back to the clinic?
I have a very long bucket list still pending,
Mhm.
and every case that I do
Still,
in my office,
is something left?
yes,
Yeah.
the top part of the bucket, which is the toughest part, it's left, and I have to work relentlessly if I want to tick mark all my bucket list. And every case that I do is going to take me one step closer to my eternal goal, and that's why I'm so excited, because I can't wait to see myself where I've envisioned myself.
Many people watching the show will not believe what you said, that something is left,
Yeah,
since
it
what
is.
you have achieved at this young age, many people aspire to achieve throughout their life, and even they are not able to reach half of what you have achieved. So I wish you success,
Thank
so
you.
that you can fulfill your aspiration. And I'm happy to be the part of this journey.
Yes, thank
Right.
you so much for being part of this journey.
Pleasure is all mine here. Dr. Apoorva, your journey is a testament of what excellence, courage, and continuous learning can achieve. As we conclude, now we are coming to the concluding remarks. What message would you like to leave behind for the next generation of the dentist and for the patient who place their trust in them every single day?
Patients who place their trust in us, I would ask them to continue doing it, and we wouldn't let them down. And I want them to really floss and brush. I'm obsessed with that. And for the younger generation, they need to be patient.
Mhm.
They need to know that good things come with time. And there's something called delayed gratification. You give 10 rupees and rupees 100 comes back, but that doesn't happen next day.
Mhm.
It doesn't take weeks and months, it takes about years, at least 4 to 5 years on an average, to reach at some point. So that is one thing. And I would really want them to build competence.
Mhm.
They need to be very confident in being exceptionally good at what they do,
Mhm.
and the rest is easy.
The message is very simple and clear. You thrive for excellence, and you are giving the same message to the young dentist to achieve the excellence in their skill set, mindset, and tool set, so that they can deliver the best of the patient outcome. And the patient has to be very careful about their teeth and the
Yes.
entire health.
Yes.
We enjoyed, particularly my team and me, enjoyed this podcast very much. I believe this was one of the most enjoyable podcasts together. I hope you would have also liked,
Yes,
right?
I did.
Yeah. And thanks to all our audiences who have watched our earlier podcast and who have invested their time watching this podcast till the end. Your feedbacks are very important to us. Just reach out to us and give your important inputs. They help us improve every day. Please subscribe, like, and follow us on our channel. This again motivates us to do much better. Thank you.